Hello, this is Dr. Virginia Ellis here at Virginia H. Ellis DVS Dental Corp. Today we are going to be answering questions about dental crowns because a lot of people ask us questions about dental crowns. What are they? How do they work? What does it take to get a dental crown? So we're going to answer questions for you, and we're going to start by Dr. Ellis. What are dental crowns? A dental crown is basically a cover or a cap on a crown, okay, on a tooth. So in a nutshell, it's kind of like this. They generally tend to look like this, okay? They can be gold or white or plastic. We'll go over that later. But it's basically a protective cover on your tooth, okay? It can be made because maybe your tooth had a huge cavity and you didn't have enough structure to put a filling in there, or maybe because it cracked, or maybe because you have an unsightly tooth that you don't like the way it looks and you wanted to cover it. That's usually done on a front tooth, okay? Sometimes you can do crowns or caps on front teeth due to cosmetic reasons, and we'll go over that later, okay? So basically it's a cover on a tooth for either aesthetic, cosmetic reasons, or protective reasons, okay? Health reasons for the tooth. All right, second question is, what are alternatives to dental crowns? Alternatives to dental crowns could be a filling, could be dentures, could be doing nothing. I don't recommend that, right? So generally speaking, if you come in and you've had a huge cavity and there's not enough tooth structure left to put a filling, and a crown is recommended, that would be the best thing to do, okay? If you're saying, no, take the tooth out, you generally don't want to do that. You'd rather keep the tooth, invest in the tooth, crown the tooth, because if you take the tooth out, you now have an empty space where the teeth will now start going like this. They'll start encroaching into the empty toothless area and putting your other teeth at risk for being lost in the future, because they will no longer be in the ideal positions to help them stay in proper positioning for easier cleaning and just basically for proper function. Okay, other question people ask me is, what are types of dental crowns, what types of dental crowns are there? Okay, what types of dental crowns are there? There are different types of dental crowns. So what people are asking, hey, what color can they be? They can be, nowadays they're mainly white, okay, but they can be yellow gold, okay? They can be porcelain, like tooth color, and it could be like this, okay, tooth colored. Or if you're a kid, a lot of times they will put a stainless steel crown, a silver crown, and those are because they're for a temporary amount of time. Baby teeth fall off, and we'll go over those in a bit. But basically, you can have a yellow gold crown, you can have a white natural looking crown like this, or for kids mainly, you can have a stainless pre-made crown, okay? The next question, okay, let's see, is what different materials are used in dental crowns and what are the advantages and disadvantages of each? Okay, so what are the different types of dental materials used in crowns and what are the advantages and disadvantages of each? Let's go over that. So basically, ideally speaking, a yellow gold crown is the best type of material, okay? It'll kind of look like this, all right? The disadvantage of it is that it's yellow. Nowadays, most people don't like to walk around with something yellow, but the advantage of it is that the material of yellow gold, okay, it's usually most biocompatible with your natural body tooth structure. It expands at close to the same rate as tooth structure when you're eating hot stuff, contracts when you're or shrinks when you're having cold stuff, and the amount of wear, the wear rate is very similar to that of natural tooth structure. So if it's rubbing against a natural tooth, it'll wear at the same rate, okay? Porcelain can sometimes wear, a lot of times wears faster than natural tooth structure, okay? So that's that difference. Yellow gold, most biocompatible, that's what they call it in our world. It's most compatible with your natural body structure, expansion, contractions, wear and tear in the body, okay? The other type of dental material is what's used mostly nowadays. It's come a long way. It's porcelain, okay? So we all know, like porcelain, like China porcelain, they have some really hard materials now coming out there that decrease the chances of fracturing or breaking a porcelain crown. Metal crowns obviously last the longest, okay? and they're less likely to break, okay? The disadvantage is that they're yellow, they're not natural looking. If you're looking for something natural, right, more natural looking, you would opt for a porcelain crown, okay? And then the other type of crown, which is mainly done for kids, is this one right here. It's called a prefabricated dental stainless steel crown, okay? This is mainly done for kids, all right? If you're thinking, oh my gosh, I just can't handle yellow in my teeth, most of the time a white crown is okay, as long as you have it done well and you take care of it. Most porcelain crowns will be okay. The best material is yellow gold, but the disadvantage is that it's unsightly because it is yellow, and a lot of people do not like to have yellow in their teeth. They like to blend in the color to make their teeth look natural, okay? All right, so the next question we're gonna answer is a dental crown necessary after root canal treatment? That's a very good question. So standard protocol, okay, or operation, mode of operation is when you have a root canal, and this is a baby, I'm gonna go over here, let's see. This is kind of like an example, okay, of someone like a cavity that's deep. This is a baby tooth, by the way, okay? So if there's a cavity that's deep and it goes into the nerve, or the tooth cracks, okay, and it goes into the nerve and kills it. Sometimes you can have a crack on your tooth and it goes into the nerve, like it shows, it probably shows here. There we go. See, when you have a crack that microscopically goes into the nerve, it kills the nerve, and then you wind up needing a root canal. Well, they'll make a tunnel in here, they'll clean it out, or if you break off a tooth or just the nerve dies, you need a root canal, they clean this out. And a back tooth, you pretty much always need a crown, because what happens is once you take out the nerve, or the nerve dies, you have these little microvessels that hydrate the tooth, right? But those are now gone, and when the natural nerve is gone, with the little microvessels, the little mini arteries and veins that hydrate the tooth, that give it moisture, it becomes very dry and brittle, and the teeth tend to break. They will break over time, okay? So standard operation or protocol is after you have a root canal and a back tooth, you always crown it. That's just, there's a lot of force going on in there when you're chewing. However, on front teeth, you don't always, nowadays, they used to do that. They used to put a crown on every root canal treated tooth that you had on, even if it were a front tooth. But now it just depends on the situation, okay? If you have a tooth with a lot of tooth structure and you have a bite that's healthy, usually you can leave that alone and just kind of cover up the entrance hole where the specialist went into the root canal. However, if you have a strong bite or you have a lot of tooth missing structure in there, then you have to put a crown. It just depends, case by case, but usually on front teeth here, a lot of times you don't nowadays, but that all is case by case. It depends on your particular situation. That's why it's good to go to the dentist to assess your own particular needs and type of situation to determine whether or not you need a crown. For front teeth, a lot of times you don't, but that's not always 100% the case. For back teeth, yes, always put a crown on a root canal treated tooth to avoid the chances, or decrease the chances, of it breaking off and losing that tooth entirely, okay? All right, next question. Okay, can you explain can you explain the dental crown procedure? The dental crown procedure, yes. A lot of times I get, doctor, what is involved in getting a crown? What does it take? What is the procedure like? Basically, number one is we make sure that you're comfortable, we numb you up. And just remember, when you go to a dentist, just because you're numb, it does not mean that you will not feel anything. No, that's not true. We will get rid of the pain so that you will be comfortable when you're being worked on, okay? So you're gonna feel cold touch pressure. I always tell my patients, it is normal to feel cold touch pressure. If you're not feeling anything, that's too numb, okay? So you will feel the cold of the water, the cold of the air, us touching the area, going with a drill. Yes, I'm gonna call it a drill because it is a drill. We're gonna basically shape the tooth kind of like this, okay? Miniaturize it, it's gonna look like this, okay? Something similar to this, okay? And then what we're gonna do is we're gonna take a mold, an impression of the tooth. Then we're going to temporize your tooth, okay, with a temporary crown. It's usually made chair side, all right? And then you're going to go home, okay, for about 2 weeks. If we send that crown to the lab, come back, okay? We will take the temporary crown off, adjust, check your permanent crown, and then if it all goes well, looks good, we cement it, and then you get to go home and enjoy your crown, okay? So 2 visits. Again, first visit to shape the tooth, clean it out. Sometimes you can need what's called a buildup if there's too much tooth structure missing, because obviously, as you can see in this tooth example here, there's quite a bit of tooth structure in here. You have to have tooth structure to make the crown stay on, right? So 2 factors, the cement and the way the tooth is shaped and how much tooth structure will determine how retentive or how well the crown will stay on, right? So if you need to have tooth structure built in, sometimes we do what's called a build-up, okay? But generally speaking, we will shape the tooth, take a mold, put a temporary crown, you go home for 2 weeks, come back, okay? We take off the temp crown, adjust the permanent crown, cement it, and then you get to go home and enjoy your crown. Sometimes in certain situations, you can have what's called a same-day crown. It's not for all situations. Some offices have what's called a direct milling machine in-house. You can have that. That's usually a much longer appointment. It's like a 3.5-hour appointment. It just depends. Not every situation is okay to have a same-day crown, okay? So just that. The best thing is when you go and send this off to the lab. That's the best result, okay? Overall, that's what I've seen give you the best results. So you can come in and ask if you have questions about that, okay? So 2 visits, 1, 2, shape the tooth, take a mold, put a temporary crown, go home, wait for the lab to make, come back in 2 weeks, take the temporary off, put the permanent crown, cement, and you get to go home and enjoy your crown. That's the answer to that, okay? Next question. Let's see. Does the dental crown placement hurt? That's a great question. Doctor, does the dental crown placement hurt? So what they're talking about here is when you come in to get your crown delivered, does putting on the permanent crown hurt? It can a little bit. It just depends. I find that a lot of people many times don't need to be numb. It just depends on your comfort level. Someone doesn't like to dentistry overall, we just numb you up. It's okay. It's not gonna be like, oh my gosh, I can't stand this. This is too painful. It's unbearable. No, it's not. It's absolutely tolerable. If you have anxiety to dentistry or if you're scared of dentistry, just let us know. We work around your needs. We'll numb you up. A lot of times I will numb up the patient, okay, so that when we take off the crown, your tooth is not sensitive. Many times if a patient has had a root canal, there's no nerve left on the tooth, so the tooth doesn't hurt, okay? So it doesn't generally hurt. It can, okay? Dental treatment is not necessarily the most fun thing, but it doesn't have to be a bad experience. We numb you up, we go slowly, we work around your needs, we talk to you, and we have a lot of people laughing and talking to us as we're working at them. So don't be concerned about, oh my gosh, does it hurt to have a dental crown? You have to find the right doctor, the right staff, and just be the right match, and just tell the doctor and the staff. If the doctor walks away and you're scared about something, or you need help with something, tell anyone in the staff and we will work around your needs. Dental work does not have to hurt or be painful, okay? We can make it work for you. Is it like getting a massage? It is not, okay? But it is tolerable and we can make it doable for you, okay? We can make it tolerable for your level. We just need to work around your needs. Tell us what is hard for you, and we will make it happen for you so that it becomes a pleasant experience or a positive experience, okay? All right. Next question. Okay. Are there any consequences for getting a tooth crown? Okay. Are there any consequences for getting a tooth crown? So what that question is really asking is, hey, what are the risks or the downsides to getting a crown? So anytime you touch a tooth, you create inflammation, much in the same way, let me show you, as if you were to go to the hospital and get tummy surgery or any kind of surgery that you get, you wake up and you're tender and you're sore. Yes, so the nerve can get inflamed anytime, even with a filling. If you do any surgery in any part of your body, including a tooth, you can have some inflammation that can, cause sensitivity to cold or touch. Most of the time, you don't have that happen, okay? But it can, or maybe your gums will be sore for a couple of days. It's very minimal for the most part. Sometimes, so we can't really ever tell. I wish we could tell you when you're gonna need more work. The risk of having a dental crown is that you can create irreversible inflammation in a tooth that could cause the nerve to die and need a root canal. Okay, so that's one of the downsides to getting a crown. Okay, so just know anytime it could happen, not just to the crown. Anytime you do a filling, if you come in and you have a really deep filling, deep cavity, excuse me, that increases the chances. If you have a really deep crack on a tooth where you are fixing, sometimes people will come in and because the tooth is cracked, you can't tell. See, sometimes the tooth is cracked, and the closer, we can't tell because this is at a microscopic level, the closer that the crack is to the nerve, the higher the chance of that tooth needing more work, like a root canal. That would be a downside. Okay, and nothing in life is guaranteed. Most of the time when we do crowns on teeth, it works. You get to keep the tooth. Once in a while, the tooth, may have a crack or may develop a horrible infection from bone loss or whatnot, and you wind up losing the tooth. That's not very common. If I had to guess, I would say, don't quote me and hold me down to this now, but it maybe say 2% of the time it doesn't work. It's most of the time, I'd say you have more than a 90% chance, generally speaking, that you're likely to keep the tooth. Okay, but just know that when you do get a crown done, then there's always a possibility for complications. You may need something like a root canal, or sometimes we go in there and your tooth has broken so close to the bone level that we can't really go down enough to be able to take an impression, and you might need something called crown lengthening, where we'd have to send you to the gum surgeon and then have them kind of nip off some of the bones so that there's height so that we can attach a crown to that. That's another downside. You may need something called crown lengthening or a root canal, but generally speaking, a crown is all you need. All right, next question. Is it worth putting children's teeth in crowns? Yes, it is. So is it worth it? So when a doctor comes in and say, hey, your kid came in, they have a huge cavity, we had to do a baby root canal, your child's tooth is going to need a baby crown. If we recommend it, trust it. Okay, yes. And this is an example. So a lot of times, oftentimes kids will come in, and this is very common, they'll be eating like chewable vitamins. Those are horrible for your teeth, raisins or crackers. A cavity goes through here, and you can't really tell until we go in here and the cavity goes into the nerve. At that point, what has to happen is you have to clean out this part of the nerve, put a buildup, and then put a stainless steel crown here. Okay, I'm looking at the model here, because if you don't, what's going to happen, that tooth is going to break off, and then baby teeth do need to stay in place. Yes, they do fall off, but when they fall off, they fall off at the right developmental stage of your child. So if you take out a tooth before it's time for that tooth to come out, what's going to happen is it's going to cause the other teeth to kind of migrate into the empty space, misalign, and then screw up the bite, and sometimes even prevent adult teeth from coming up. So yes, it is necessary to put crowns and baby teeth when needed. Okay, so again, is it worth putting children's teeth in crowns? Children's teeth in crowns. Is it worth putting children's teeth in crowns? Yes. So if you need a baby crown for your child's needs, yes. Okay, they're different from adult crowns. All right. The next question is, do crowns look like normal teeth? Great question. Generally, yes. It depends on how well they're done and what material you're using. Okay, so just remember, you get what you pay for. Okay, if you're going to the cheapest place and it's just the mill, there are places like that. Don't expect to have a tooth look, generally speaking, like a natural tooth, because to do that, you have to send, this is the stuff that the general public doesn't know. You have to send that crown lab work to a good lab. You have to take the time to be able to do a good crown. And it takes time and money and good staff. And if you're thinking about, I'm just going to go to the cheapest place, you're going to get what you pay for, generally speaking. Because in order to get good dental work, you have to train your staff really well. You have to use really good materials. You have to go to continuing education courses and constantly improve yourself to become a best dentist you could possibly be, to give the best service to your patients. And that takes money. And if you're not willing to invest in paying what your teeth are worth, what you want your teeth to look like, you're not likely to get what you're looking for, okay? So yes, you can get teeth to look like, crowns to look like natural teeth. It just takes experience, technology, the good lab, good staff to help you do that, okay? So you can make a tooth look really normal. Like for example, this material right here, there's porcelain. It can look really normal. I have a lot of people with dental work, porcelain work in their front teeth. It works really well. You have to be patient, be willing to pay the money that is requires to get you the results that you need, and be patient. Work with the doctors and the team and the lab, because sometimes cases will come back and they don't look the way you want them to look, or they don't fit the way they want them to fit. Most of the time they do fit well when it's cementation day, but sometimes it doesn't, and you just have to work with the doctor, have to work with a lab, and you will get what you are looking for if you want your teeth to look really natural. I've had many cases where that happens. I just let the patients know you got it. Sometimes you have to go to the lab and get a custom shape to make your teeth look really natural, okay? So the answer is yes, but you have to be patient. You have to be willing to work with the staff, the doctor, the lab, and you have to be willing to pay for what you want. You get what you pay for in dentistry, and a lot of times people don't realize that. Just remember that, okay? It's a match. All right. Next question is, how should I take care of my dental crown? That's a great question. How should I take care of my dental crown? Okay, the way you take care of your dental crown is two ways, okay? You obviously go to the dentist that does a good job, okay? And then you do your part. Your part is to come in and present yourself for the recall appointments. What I mean by recall appointments is like your checkups, your cleanings and your checkups. It's very important that you come and do so, because we remove stuff that you can't remove while you're at home, okay? And also you practicing good hygiene at home, okay? Brushing your teeth properly like we recommend you to do. And also flossing. Flossing is super important, because the main place where crowns usually fail is you get gaps like, let me see, right here, there's like a gap that causes an opening. I think you could see like an opening here, okay? There's a gap in here. That's the number one reason for us really having to replace a crown. It usually happens here on the side or in between the teeth, okay? In between the teeth is really where most crowns start to break down, and that's because of lack of flossing. Most people don't floss. It's a fact. You should. We still love you if you don't floss, but do come in for your checkups. But floss, okay? Make sure that you're curving in between. Some people just go straight. You have to curve, okay? Curve around the teeth, because as you can see, teeth are not just flat, they're curved, okay? And most people don't curve around here. You need to floss properly, okay? So how do you take care of your crowns? By coming to your checkups whenever you're recommended to do so. So you should do it every 3 to 6 months. If the hygienist or the doctor tell you come in 3 months, don't think that you're special and you can come in 6 months. No, we're telling you what you need. You should follow the recommendations, okay? Floss every day and get feedback. Ask them. Ask your hygienist or your dentist, hey, how's it looking in there? Be proactive. Don't just come sit down and then leave thinking that the dental cleaning we do here is going to make up for all of the days that you don't floss at home. That's a really important thing. Flossing is super important. Making sure that you're brushing well, and using fluoridated toothpaste does help. Fluoride does help remineralize or harden the areas that get decalcified from the acid attacks of the food that you eat, okay? So just remember, that's really important. Floss, brush, come in for your hygiene checkup appointments. That's super important, okay? All right, next question. Okay, let's see, is it worth putting, okay. How long can you expect a dental crown to last? Okay, that is really a good question. How long can you expect a dental crown to last? Okay, insurances will cover, this is general stuff, 5 to 7 years. It really does depend, okay? You can expect them to last as well as the crown is made and as well as you take care of it, okay? So what does that mean? What that means is if we do a good job with your dental crown, it'll last you a long time, providing that you take care of it. And that's what I just meant in a previous question. By coming in for your dental checkups, by making sure that you have a good healthy diet that's not too acidic or destructive, making sure that you're not biting on hard things like ice, okay, super hard bread, popcorn, okay, because sometimes even on a crown that's like porcelain super strong, I've seen a couple, not many, people will bite on a popcorn kernel and break the crown, but at least the tooth is generally saved, okay? So just making sure you're not biting on super hard things, making sure that you're cleaning your teeth will allow you to have a crown last long. You could go 7-10 years maybe, 5 to 10 years, sometimes even 15, okay? But it's like a car. If you have a really well-made car, okay, for most people, let's just say the general population, we all know Toyotas are really well-made. They tend to last a long time. But with a Toyota, if you don't take it to the recall maintenance, if you don't change the oil, take care of the engine, it's going to break down on you, okay? We all know Toyotas are really good cars, okay? Even a Lamborghini. I tell people, I have placed a Lamborghini in your mouth right now. But what happens to Lamborghini? Beautiful piece of, science and art put together, and it's done very well, performs beautifully. But if you don't take care of it, you don't maintain it, that thing's going to leave you stranded on the side of the road, right? Same thing with a crown. A crown that's well made will last long. Could be at least 5 years, 5 to 10, 7, 10, 15 years, okay? But it depends on how well you take care of it. It's like your home. If you do not maintain your home, the paint is not going to last as long. The roof is not going to last as long. You have to maintain things to help them last longer. It's the same thing with your teeth and your crowns, okay? All right, so answer the question. Minimum usually 5 years, but if you don't take care of your teeth, that thing will last you 2-3 years, okay? It depends on how well you keep your teeth, okay? Hygiene appointments, chewing habits, wearing a night guard if you need to, coming in for your checkups, okay? And using fluoride definitely help. Okay. Next question will be, does insurance cover dental crowns? That's a very good question. Okay, what people have to remember with dental insurances, sometimes they cover crowns, sometimes they don't. Every insurance coverage is different, okay? You could have the same insurance name and have different coverage depending on the company that you work with, okay? What people do not realize is when you're trying to get a crown covered by your dental insurance, oh, I don't have dental insurance right now, I'm gonna get one so I can get it covered. Sometimes they have waiting periods. Sometimes they have pre-existing conditions. So every situation is different. That is something you wanna just check with our office or your dental office. And just because you and your spouse work for different companies and have the same dental insurance, it does not mean that you will have the same coverage, because that coverage is actually determined by the negotiation that the representative from your company had with the representative with that dental company, okay? So they're not always covered, sometimes they are, and usually there's limitations. Most insurance companies will cover up to $2,500. That's most, that's like the most that they'll cover, okay? Most of them will have a limit. Actually, not most of them will cover like $1,200, sometimes $2,500. And you have to remember that insurance coverage has not increased since the 1960s. We're in 2024. In 60 years, what used to be covered 60 years ago, that money went a long way compared to now. So just remember, check with your dental office. They can help you figure out what the coverage is likely to be. At the end of the day, you don't know what they're going to pay until they pay, because even when you call a medical insurance company, insurance coverage of insurance is not guaranteed of paid services. I'm like, what does that mean? At the end of the day, you don't really know what they're going to pay until they pay, okay? We do get a pretty good idea, but the best thing is just to ask and never assume that they're going to pay 100%, because sometimes insurance companies have surprises up their sleeves, okay? So never rely on insurance companies to determine the kind of care you're going to get for yourself, because at the end of the day, it is your health and you're the one living your life. You're the one living the consequences, okay? Invest in your health. Your health is your wealth. If you do not have your health, you can't enjoy your day-to-day activities. Sometimes even simple things like smiling with confidence can become challenging. Eating, a piece of bread or enjoying that ice cream can become a challenge. So do what you need to do regardless of insurance coverage. There are ways for you to be able to afford crowns, okay? It could be options for credit, ask your dental office, and they'll help you. We'll work around it some way, okay? All right, there's always a will when there's always a way when there's a will. All right. How can I schedule an appointment for a dental crown? That's very easy. How do you schedule an appointment for a dental crown? Call our office, okay? If you need a dental crown, if you don't know if you need a dental crown, come in. We're going to check to see what your situation is. Don't just assume, oh, I'm going to get a crown. Sometimes you know because you've gone to a dental office, but sometimes there's another option for you out there, okay? So just call our number, 925-254-4043, or if you're not in our office, you're out of state, you're really far, call your dental office, okay? And if you have a question, ask for a second opinion. If you don't know who, a good dentist would be, call a specialist office. They see everybody's work. This is something people don't think about. They see everybody's work. They know who does good work. That's a good route, okay? So that's a $100,000 piece of advice I can give you. So just call our office. Call your dental office if you need a dental crown, and we can go over it because there are going to be many factors. What your health history is like, what the financials will be, what your emotional needs will be, because it's not just about fixing your tooth, it's about addressing your emotional needs, right? We want dentistry to be really comfortable for you and to be a positive experience. All right, so let me see. I hope we've been able to answer some of these questions for you here, and what dental crowns are. And if you have additional questions, feel ready to take action, give our office a call, okay, at 925-254-4043. So hopefully you've had all your questions answered. If you have further questions, give us a call. All right, I'll see you at your next visit. Bye.